Why global pharma powerhouse India is being called pharmacy of the underworld. What are the causes behind recurring contamination of drug tragedies taking place? How India's accountability system keeps collapsing post-tragedy. Where is the wrong and what needs to be put right? India is known as the global pharma powerhouse, yet we have recurring drug contamination related tragedies, which raises not only regulatory concerns but serious ethical as well as governance concerns. Hello everyone, welcome to Vajiram and Ravi's Flash News. My name is Shubhangi Singh and today we are going to understand why India, when it is supposed to be the pharmacy to the world, it has come in a questionable place where it is being called the pharmacy of the underworld. Recently in Madhya Pradesh, 20 children lost their lives because of a cough syrup which was contaminated by a drug which is not supposed to be used. It is an industrial solvent. And these deaths were not limited to that state. We have seen other deaths related to the similar cough syrup in Tamil Nadu as well. But the question here is why this has been happening, how frequent this has been happening, is it present at the global scale, and what needs to be done. So let us start with understanding the situation at hand. Recently we saw that there were deaths of 20 children in Madhya Pradesh who consumed cold ref cough syrup, and these deaths have been linked to an industrial solvent, that is DEG. DEG is diethylene glycol, which is a toxic industrial solvent. As soon as this happened, there was immediate outrage that was called for, and then the state drug controller was transferred, officials were suspended, doctors were arrested. But the question rises here is, what do we do of the immediate outrage when this incident has not been a singular incident? There have been such incidents in the past that highlight that there are systematic weaknesses that exist in the system. And when we are aiming to become the pharma powerhouse, हमारे यहाँ अभी भी ऐसी प्रॉब्लम्स हैं जिनको एड्रेस करना ज़रूरी है. नहीं तो हमें यहाँ पे सिर्फ इकोनॉमिक आउटपुट में कमी नहीं दिखेगी, साथ ही साथ हमें यहाँ पर ग्लोबल इमेज और साथ ही साथ सोशल एथिकल गवर्नेंस पॉइंटर्स पे भी काफी लॉस जो है देखने के लिए मिलेगा. So in such events, what we have, when we are talking about such events, the main lesson to be learned from them is that there is an immediate need for structural reforms which has been missing from the past. Why I am saying from the past? Because this is not the only incident that we have seen. In last 5 decades, if we talk about, we have seen more than 20 plus such tragedies where drug contamination has been the main reason, and we have seen multiple deaths where we have seen a pattern of negligence. It is not a coincidence. और ये जो ट्रेजेडीज़ हैं जो कि अलग अलग स्टेट्स में हुई हैं, ये क्लियरली दिखाती हैं कि हमारे स्ट्रक्चरल इश्यूज जो हैं वो एग्जिस्ट करते हैं नेशनल फ्रेमवर्क में, एंड बेसिकली इंडिकेटिंग दैट देयर इज अ नेशन वाइड सिस्टमैटिक वीकनेस. In many of these you will find, even back in 1986 we have had the issue of DEG contaminated IV fluid, और यहाँ पर सेम कंपोनेंट जो है इस वक्त रिस्पॉन्सिबल है जो डेथ्स हुई हैं. सो व्हेन वी टॉक अबाउट DEG, एज आई हैव ऑलरेडी हाईलाइटेड, ये क्या है? ये एक टॉक्सिक इंडस्ट्रियल सॉल्वेंट है और इसको यूज बहुत सिंपल रीजन से किया जाता है और इलीगल तरीके से किया जाता है, क्योंकि इसके यूजेज से कॉस्ट जो है फार्मास्यूटिकल्स का वो कम हो जाता है. इट इज यूजुअली यूज्ड इन प्लेस ऑफ ग्लिसरीन and it facilitates in reducing the production costs, and it is done illegally. So if a human consumes this industrial solvent, it will lead to acute kidney failure, liver damage, and in worst cases deaths that we have seen multiple times. But the question is, why haven't we done? Are there any other countries who are addressing this situation? I'll give you a very good example here. First DEG poisoning was seen back in USA in 1937, and there were more than 100 plus deaths. So what did US do back then? It marked a defining moment in drug regulation, because in 1937 only they bought a Federal Food, Drug and Cosmetic Act which was enacted in 1938, and no such incident has occurred since then. And this stands in an extreme contrast to what we see in India, where such incidents have previously occurred, and even after almost 80 years of independence, we still get to see such cases. These cases are not limited to our states. Such cases from the Indian pharma producers and manufacturers we have seen in global areas as well. We have seen outside in foreign areas as well. For example, if you talk about Gambia in 2022, 69 children died. That was the pharma producer of India, that is Maiden Pharma. Uzbekistan in 2022, we had 18 deaths. Marine Biotech in UP was responsible for that. Marshall Islands in Micronesia, 2023, WHO went ahead and issued an alert on Indian syrups and Indian made medicines. So this is a problem where we are not only facing export bans, we are not only getting a diplomatic embarrassment, but also we are in an ethical situation where we have to answer that why our systematic failures is leading to deaths across the globe. Not just in our country, we are costing lives across the globe. And why haven't we done anything about it till date? This is not something that has happened just now. ये पहले भी हुआ है, इसको address क्यों नहीं किया गया? Furthermore, if you will notice a pattern, there are different companies which have been involved. The deaths have taken place in India and outside. That again highlights that there is a oversight failure. There is a regulatory framework failure which is happening again and again. If I talk about the Gambia case in which WHO brought in a report, India highlighted it as inadequate, and the Marine Biotech, these producers were initially suspended but they were reinstated later. So this shows that we are taking this very lightly. Furthermore, if you will see, pharma products are being tested before export, but they are not tested before domestic use. That highlights that we are prioritizing foreign lives before our own country's people. That clearly shows that when we are aiming to become a developed country by 2047, we are ready to be known as the pharma powerhouse. There are serious concerns at the foundational basis that need to be addressed. Otherwise, this dream in terms of GDP might look good, but in terms of the lives that are going, is going to be a sore for our eyes. Now the question arises कि आखिर ये इंडिया में इतना कॉमन क्यों है और ये बार बार हो क्यों रहा है, इसके पीछे रीजन क्या है? So basically, what are the reasons that this keeps recurring and this is so common? That why such substance or substandard drugs keep appearing in our pharmaceutical industry? So there are multiple systematic as well as governance based causes to it. Let us look into the systematic causes or systemic causes first. The first issue is the oversight itself. We have already spotted that issue, that there is an oversight failure. But how that oversight failure is occurring? The problem here is that there is weak regulation that is involved. How? So if we talk about CDSCO, that is Central Drug Standard Control Organization, it overlooks almost at 250,000 manufacturing plants. But the manpower and labs it has to monitor them and test them, it is limited. If we look at the overstretched limit that at present CDSCO is in, that we have only one inspector per 250 manufacturing firms. That shows there is absolute inadequacy in terms of addressing this whole issue. Second thing that you can find is the corruption as well as the political influence, which is very widely present in our country. In this situation, we are seeing that licenses are being issued as well as they are being renewed without any inspection. That means if the inspection is not done, the testing is not done, if the product is not understood, then anything and everything can go out in the market through these pharma units. Another systemic issue is the small pharma units that exist. As about 65% of India's pharma units, they do not have the ability to afford the in-house labs for the testing. Mostly what they do is they outsource it, and in many scenarios it is seen they buy from unverified buyers as well. So in this situation, it directly fuels the fire where there is lack of regulatory oversight, there is extreme political influence, corruption, quality checks are not existing. This further adds to it. And then when we talk about enforcement, that is also inadequate. So when we are talking about weak enforcement, a very good example is GMP norms, good manufacturing practice. The norms are laid out such that the quality is ensured, the quality standard is maintained, and consistency is also ensured. There are regular violations that we have seen of GMP norms, and in order to address them, there should have been stricter enforcement of laws. Instead, we have seen lenient laws. So if you talk about Jan Vishwas Act of 2023, which initially talked about imprisonment for violation of laws, it has turned it into fines. And back that time, this issue was raised that this will lead to manufacturers, pharma units bringing in more substandard products because they will not be afraid of default because it is only related to fines. There is no imprisonment involved, no jail involved. Now that we have understood the systemic issues that exist, now let us move into understanding that how there are governance issues also there which make it a whole link and consolidate this whole systematic failure that we are seeing. In the governance issue, the first thing that we are finding, whenever a tragedy takes place, there is an immediate outrage, suspensions take place, and after that people forget about the incident, but there is no regulatory framework that is changed. Basically, it is like blaming the soldier for the defective weapon that are existing around. Initially, it should have been addressed in form of a proper change in regulatory framework. अगर हम बात करें यहाँ पे लेंटिन कमीशन की, that was out in 1986, इन्होंने यहाँ पे एक proper report निकाली थी JJ hospital tragedy जो मुंबई में हुई थी, and based on that they called for an administrative overhaul back in 1980s itself. Even after 40 years, there has been no change, and this whole trial of this recommendation is still pending. So all we get to see, there is weak prosecution, accused have either died in this case or they have aged out. All this situation clearly show the fact that even if manufacturers are penalized, then they have the ways of getting out. The judiciary is so overburdened, the governance is failing here, and the regulatory mechanism is close to non-existent. That makes it very difficult for us to become a powerhouse when we are talking about in terms of pharma. This only shows the fact that public health is not being treated as governance priority, and in this case, justice delayed is not justice denied. Justice has become absolutely irrelevant because the cause of it is not being addressed at all. Now the actual question comes, and this can be a case study, that what India needs to learn and how it needs to be done. Some global practices that can be used by India to address this situation. If we talk about US, the establishment of FDA, which talks about proper pre-market approval and also post-market surveillance that takes place. For example, if we talk about UK, MHRA, which also has an independent audit body, there are proper public reports, and Japan has PMDA, which have digital traceability, especially of raw materials. If we talk about EU, it has EMA, which talks about rapid recall and also transparency which exists in their systems. Basically, we get to see a pattern here also that drug quality is being treated as high as on the priority as national security is, because there is investment in not only monitoring but also in real-time testing, whistleblower protection, and this is what India needs to replicate as per its own requirement and real-time standards. Other than that, let us look into what is the way forward, what kind of reforms could actually mend the situation. We cannot go back in the past, bring back the lives, but we can definitely save the lives in the future. What needs to be done? First, we are looking towards an independent national drug authority which has centralized labs so that there is testing, there is real-time monitoring. Furthermore, batch testing needs to be mandatory not just for exports but for domestic usage as well. That means the drug does not need to be tested only once. Every batch that is being released needs to be tested. Digital batch tracking and QR verification also needs to be brought in. Stricter penalties, and when the cases are of deaths, there needs to be more than just suspension, so that the justice is actually delivered when we are talking about usage of substandard drugs. Apart from that, public transparency, so that the blacklisted firms or the firms that have used substandard products in past are the ones which public is not buying. Then empowering whistleblower, if people come up and let the information to the public, inspectors are taking effort, they need to be protected. For example, Lentil report was 286 pages in total, which not only highlighted corruption, substandard drugs, but also that how public health lied very low on the priority. That needs to be empowered, that needs to given the form of a reform itself. Then there needs to be a cross-stakeholder consultation, so that patient, judiciary, doctors, manufacturers and civil society can actually sit up and make the norms which need to be followed. And the most important part here is ethical revival. When we are talking about India's pharma might, it needs to be matched with ethical responsibility, not just for foreign lives but for domestic lives as well. It will come with a combination of accountability, better governance and real structural reforms. What do you think about it? Let me know in the comment section. I'll leave you with a practice MCQ here. You can put down your answers in the comment section. That was all from my side. Thank you so much.